Hello, and welcome to another edition of Orthopedic Sports Medicine Patient Educational Series with Dr. Adam Derhake. In this video, we're going to look at the specifics of the surgical procedure required to perform a biceps tenodesis operation. For the purposes of this video, we're going to be looking at a right shoulder. And you can see the ball in the socket of the right shoulder here. When we zoom in and we look at the specific structures of the shoulder, we can see the collarbone up here. The shoulder blade comes around the top here, with the rest of the shoulder blade in the back down here. Oftentimes when performing a biceps tenodesis, but not always, we are also addressing problems with the rotator cuff. Here we see the tendons of the rotator cuff attached around both the front as well as the top of the ball. This is the subscapularis tendon, and this is the supraspinatus tendon on top. For the purposes of this video, though, we are going to concentrate on treatment of the long head of the biceps tendon. If we discussed the biceps in the office, then you know that biceps, bi means two, meaning that the bicep muscle itself has two tendons that attach up top. So here is the bicep muscle down in the arm, and it has two heads. It has a long head, so this is the long head of the biceps tendon, and then a short head. The short head attaches over here on this bony prominence called the coracoid outside of the shoulder joint. The long head of the biceps attaches onto the top of the socket inside the ball and socket joint, and so this tendon can be a source of pain or symptoms within the shoulder. In order to eliminate that, we perform a biceps tenodesis. So again, highlighting here the long head of the biceps, we want to initially come into the shoulder via a cannula. This is through a poke hole in the front of the shoulder with a stitch. We will then place an initial tag stitch on the biceps tendon so that we can control the position. We then cut the biceps off of the top of the socket here and prepare to reattach the biceps at the top of what we'd call the biceps groove or the bicipital groove. We will then punch a hole up here at the top of the biceps groove and place an anchor into this suture that will then direct the biceps down into the hole, and then we will affix it with a screw. This particular video describes an onlay technique as opposed to an inlay technique. Onlay means the tendon isn't actually put down into the hole. I like to actually put the tendon down into the hole so that when I secure it with a screw, it is more secured. So as we advance the implant, the screw goes into the hole, completing the repair of the biceps tendon to the humeral head. So now the end result is no longer is the biceps attached over here at the socket, it is now attached at the head, and all of the length of the biceps tendon that was previously inside the shoulder joint has now been removed out of the shoulder joint. Because it is being reasserted at the top of the head here, the biceps is still anchored and it's just simply pulling from a different position. However, as we will discuss in the rehab protocol, once we reattach the tendon here, the tendon now needs to heal in this position, and so we do have restrictions on you pulling on this tendon following the tenodesis. I would like to thank my friends at Orthopedics for providing the implants necessary to perform a biceps tenodesis, as well as providing this excellent surgical animation for this video. I hope this has helped you to better understand exactly what a biceps tenodesis is and how we reattach the tendon. Have a great day.